Hi, Tornisha.
Hello, how you doing?
Good. How are you?
I'm good. How's everyone?
Hey guys.
Hi,
Hi.
Caitlin. Hi, Margaret. I know Anthony Nolan, one of our HEAL co-chairs, has a conflict today, so unfortunately he won't be able to join, but we have the recording running, so we'll be able to share this with everyone afterwards as well. Hi, Sharon. All right, I have 12:02, so as promised, we can go ahead and get started. Thank you all for joining the December Healthy Eating Active Living Workgroup meeting. We have some exciting presentations today. We have a partner presentation from Brighter Bites. We've got prevention link updates, and then we have news to share about the Prince George's Fresh Evaluation Report. And then finally, we'll end with any additional community announcements. So if everyone can, please take a minute to either introduce yourself. You feel free to chime in and come off mute if you want to introduce yourself in person, or you can certainly introduce yourself in the chat. Please provide your name, your organization, and how do you stay active when the weather is cold? This is really my personal survey because I'm having some trouble figuring that out. Is anyone on that's new to the HEAL work group today?
Yes, I'm new. I'm Aruna Nathan. Let me turn my camera on. Hi.
Good
I'm new
afternoon.
to the HEAL group. I work in PGC in absolute care. I'm a primary care physician and also a lifestyle medicine physician.
Excellent. Thank you for joining. And Rajni?
Yeah, I was going to say I'm also new, and I will be presenting in a few minutes. But my name is Rajni, and I work with Brighter Bites. And I'll leave it at that since I'm going to talk in a few minutes. But it's nice to be here. Thank you.
Thank you.
I don't remember if I'm new to this or if I was in HEAL a while ago. I don't remember if I've been recently. So I'm Caitlin Murphy. I'm Chief of Public Health Innovation and Policy at the Prince George's County Health Department. And I have not been staying active in the winter, even though usually I do go to the gym. So I gotta get back on it. So I too will be listening to everyone's results.
And I just realized I didn't introduce myself. So I'm Kim Stinchcomb. I am the manager of the Healthcare Action Coalition. I would say in previous years, I've tried to stay active by, getting out if there's snow, some snowboarding, but we haven't had that. I'm hopeful that this year we'll get some opportunities.
Good morning. I'm not even sure if I should be on this meeting, but I'll say my name's Vera Thompson. I'm with Environmental Health. And how do you stay active when the cold weather? I wish I know how to stay active when it's cold outside. I guess I stay inside all the time. But I don't know. Am I supposed to be in this meeting?
So this is the Healthy Eating Active Living work group. It's certainly applicable to your work if you're interested in sitting in. So we welcome you to join and kind of hear some of our speakers today. We'll have updates from Prevention Link and Brighter Bites.
Okay. All right. Thank you.
Thank you. All right. Well, everyone can continue giving introductions in the chat. I know we still have some people getting on, but I think it's a good time to go ahead and get started since we want to make time for both of our presentations. But just as a reminder, before we open up to presentations, I want to remind everyone of our vision with the HEAL work group. We envision Prince George's County as a place where everyone has access to fresh, nutritious food and environments that promote good health, wellness, and active living. So now I'd like to introduce Rajni Sudlarent, a senior program manager with Brighter Bites. She's a mom, baker, lover of fresh foods, enjoys experimenting in the kitchen. She's inspired by her garden, international travel, and sharing her culinary creations with friends and family. And we're excited to have Rajni share today with us. So I will pass it over to you. I will stop sharing my screen.
Thank you, Kim, so much. And thank you, everybody, for this opportunity. I had the chance to meet with Kim maybe almost a couple months ago now, sometime earlier this fall, and just hearing about the work you're doing and sort of how it might align with the work that Brighter Bites is doing was really exciting. So I think I just shared, did I share my screen successfully? Can you see a slideshow?
I can see your screen. Yep.
Yeah.
Okay, 1 second. Okay, here we go. So I work with Brighter Bites. I'm here today to share a little bit about what our program does and how, honestly, just that last slide that Kim shared about making sure that everybody in Prince George's County has access to healthy food and has the environment to be able to make healthy choices. That's definitely at the heart of our program. So we've been around since 2012, excuse me. We're a national nonprofit. We're actually based in Texas. In this area, we've worked for about 6 years. And our mission is to create communities of health through fresh food. So these are things that this audience knows all too well. Fortunately and unfortunately, I guess it means that we have a mission, right? We know that there's high rates of overweight and obesity amongst children in the U.S. Most of them are not eating the amount of fruits and vegetables they need on a daily basis, and the cost of the things that children are struggling with due to obesity is a lot. It's a great amount. So we know that there's a lot of food in this country. It goes to waste. We know there's a need, and it's a right. Honestly, for us, it's something that everybody, every child, and their families in the community should have access to. So Brighter Bites is the nonprofit that is delivering fresh fruits and vegetables directly to families. We're showing them how to use the produce, and we're watching their behavior change as a result. Our program is aimed in changing the lives of thousands of families across the country, and we would love for everybody here to join us. And I'll talk a little bit about that later in the presentation. So what is it exactly that we do, and what's our magical formula, if you will? We've got 3 parts to our formula. We do produce distribution. So on average, our families are getting around 50 servings of fresh produce every time they see us. We see families a total of 16 times, and I'll explain a little bit more later on how do we find these families and who are these families. But they're getting a healthy dose of servings free. Nobody is paying for this produce at the community level. We also pair it with nutrition education. We're using evidence-based curriculum in the classroom and our materials so that the whole family is learning. What's happening at school is connecting with what the family is able to learn about and practice at home. And then we want everything to be fun. We've definitely seen and understand from changing behavior, if we're going to make it lasting, it's going to need to be a very positive experience. So that can take the shape of culinary demonstrations. We've got lots of tools and tips. So we're really wrapping all these 3 pillars or components of our formula into one comprehensive program. And we're using these experiences and going through these steps in the program to measure our outcomes and determine our impact. So just a little bit more of what this actually looks like in practice. So, again, we know that research shows that children are not eating enough fruits and vegetables, and they're consuming a lot of those sugary, sweetened beverages. So to combat that, we have the fresh produce coming to the schools. So that is our model as Brighter Bites. Our founders are still mothers, but once upon a time, they were mothers of elementary students, and they said, why is it my child, chooses to eat blueberries at a birthday party instead of the chocolate cake? Because they've had access to it and they know it tastes good and they know they like it and they know what it is. And just taking a very simple experience like that and saying, why can't we bring that to more families? So that's where Brighter Bites got started. And so bringing food to schools, we knew we would have community members that we could build trust with. We knew we could have partnerships. And really, again, thinking about the different components of the program, where can we meet the families where they're at on a regular basis and start young at the elementary school level? So that's our focus. So again, like I said, we give everybody access to all these fruits and vegetables for free. Our process of enrolling is very simple. So we also focus on the teaching side. We know that it's not just enough to give them access to the fruits and vegetables. We're trying to introduce them to things that they've never tried before. We aim to give them around 8 to 12 different items every time they see us, which I said is on a biweekly basis throughout the school year. We're designed to be a program that lasts up to 3 years at a school. So we're 3 years on, and then a school could reapply again 3 years later. And if you can kind of think about what that does in terms of like the expanse and reach that you can have within a community, it keeps expanding and growing. I can give you an example of a family that volunteered at a school a few years ago that's already graduated, and she's since moved to a school that we're currently partnering with. So there's a lot of continuity, and as you all work in Prince George County as well, we're definitely finding ourselves further entrenched in the community and connected with all of our different families and our parents and the educators. It's been a really positive experience. So again, we know that they're not getting enough of that nutrition education in their classrooms. So we're able to bring that through this program, and we provide teachers, again, it's evidence-based curriculum that we're using. We do train the trainer with the teachers. So it's really putting teachers in the position of being health educators and role models for the school, for the families, their students. And you'll see a little bit later when I share a little bit more about the impact of all this and the results, is that the teachers themselves directly benefit. Not only are they learning alongside their students, they have the opportunity to volunteer when we're at the schools on Brighter Bites days. They also get to participate in receiving the fruits and vegetables. Many of them do, so that they can also be practicing and learning eating healthy. So it's just been a really positive experience. And then my most favorite, honestly, no surprise, right? It's the fun part where we really bring the food to life. I can't tell you what a difference it makes. And I'm sure you all have seen this in your work as well. When you share a recipe with somebody, like, I've never eaten beets before. Okay, we have a whole directory and online recipe. Let's try, and we'll actually make samples. You can see in some of these pictures here. Let's try the Brighter Bites beet and orange salad today and see what you think. And it works. There's always ways of modifying things, but it just really gets everybody over those initial barriers of the yuck factor. My family doesn't eat that. We don't know what that is. We help them get past those points, and we try to make sure that they're having fun along the way. Again, we know that they're not eating, a lot of the foods that they're eating are going to have empty calories in it. So really just trying to bring them, different tasty recipes. All of our recipes have been tested. They've been kid and, mother approved, and they're easy to make, they're affordable, and they're tasty. So again, we pair everything that we do with a lot of resources to build that knowledge and awareness, and give them the opportunity to practice eating healthy with us. So as I mentioned, we're a nationwide organization. This map is actually missing a couple of new cities. We're in Phoenix now, and we're just getting started in New Mexico. So it's really exciting to see how we started in Houston and have grown this much, going on our 12th year. As I mentioned, our model is to work with elementary schools. We do summer programming, with early childhood centers and some summer camps. But our focus really is on under-resourced areas. So for example, in this area, the schools that I'll show you in a second that have partnered with us are all Title I community schools in Prince George's County. We do have a couple of sites that we're working with in DC in the public schools, but all of them would have applied to partner with our program. And they would all be Title I schools that are servicing the under-resourced community, those that are qualifying for free and reduced lunch. So just a little bit more about what this looks like and how we do all of this. And then again, we're engaging our community. We operate as a cooperative, so we are always looking for volunteers to join us. In the mornings, you can see here, like once we've loaded everything up in our trucks and the produce is actually on site at the schools. Volunteers, you'll see that picture to the far right. We have an assembly line of volunteers who are unloading all the foods, packaging them during the daytime on site at our school. So it's a really great way to engage with the school community. We bring in parents, we bring in staff and teachers. Students often are contributing. We have a lot of students at the high school, middle school level who are required to do community service hours. And then, organizations and other groups come in. So it's really great. We build team. You can imagine if we're with the school for 3 years, anybody who comes in, they get the Brighter Bright shirt. Everybody feels like they're part of the community, and they are, playing a hand in making sure that these families get access to all this healthy food at the end of the day. So a little bit more, again, of what this looks like. And, it's all about repeating the cycle, right? We want to make sure that if we're changing behavior, we know it takes time to adopt behaviors and maintain them. And so this is a cycle that we have ongoing throughout the school year so that we are really building these strong partnerships with our families. And we definitely could not do this without our many partners. Locally, I give a shout out to the Capital Area Food Bank, 4P Foods, one of our logistics partners out in Warrenton, Virginia. We receive a lot of our donations from the Coastal Sunbelt, which is based in Laurel. We really could not do what we do without the many moving parts and pieces, and are forever grateful for them. As I mentioned, we offer this program for free to all of our families. That's really important for us to be able to, not have that burden put on families, but, really treating them with dignity and respect. This is something that everybody should have access to. So, and we know that it works. So this might be of most interest to this group is how do we know it works? So as an organization who is evidence-based and research-informed, we're always asking ourselves 2 questions. Are we implementing as we planned? And are we actually changing behaviors and increasing demand for fruits and vegetables that in the communities that we're serving? So we do real-time monitoring of key performance indicators. I can tell you that our team is constantly assessing family participation, our enrollment numbers, are we meeting our goals? Our goals from 1 year to subsequent years in the 3-year cycle increase. We anticipate that as our schools get more familiar with the program, we are going to see greater results, and we can kind of push and challenge our schools in that way. So whether it's tracking in databases, doing site surveys, or collecting family feedback in other ways, we're definitely always looking for ways to improve our program. And honestly, at the city level, with my team, we are constantly doing that on a weekly basis. We're always learning something new each week. So, we're looking at how much are we actually distributing, how many people are we reaching, and variety. Variety is really important for our team to be making sure that we're giving families as much exposure as possible to different fruits and vegetables. And we've seen that, especially after our 2-year follow-ups, we're seeing a significant increase in snacking, healthier, eating more fruits and vegetables, drinking less of those sugar-added beverages, and, just parents and children in general are continuing 2 years into the program to significantly consume more of those fruits and vegetables, which is really awesome. Again, another slide just kind of shows you like the results are increasing those numbers of fruits and veggies, but also being able to maintain it. And this shows you a little bit more, just sort of that growth over that 2-year period. And so I just wanted to add these as well here, is that, in addition, we're seeing parents reporting that we're helping them save money. I mean, again, it varies from week to week what we're receiving in the bag, but on average, I would say anywhere from like $30 to $35 easily families are saving on grocery. I have families tell me all the time, I know you're coming this week, so I did not buy X, Y, and Z. You saved money for us. I could focus on something else that week instead. So nutrition security has definitely increased after a year of programming. And then our teachers, this is, something maybe we weren't originally attending, but it's phenomenal to see that teachers are also saying that they're being influenced by the program, the fruits and vegetables that they're consuming, and they're seeing a lot more parent engagement at their school because of the Brighter Brights program. And they're able to encourage their parents to eat healthier and adopt healthier behaviors because of what they've been experiencing as teachers with Brighter Bites. So it's definitely had an impact not only in families, but in the school environments as well. So I just wanted to share a couple of things. I won't read them all, but you can just see these bright faces and sort of just the impact from the teacher's perspective of how this makes a difference, how, it comes to life in their classrooms. The kids are getting excited about the different lessons they're learning. And then the families as well, whether it's for economic reasons, it's introducing their family to variety, it's helping families struggling with, either themselves or their children not wanting to eat, say, vegetables, because that often happens. So it's really giving families and honestly putting the community in the driver's seat of being healthy and having what they need to be able to make those choices. So I'm hopeful, today and moving forward in the future as well. Of just our door is always open. We're always looking for partnerships and opportunities to collaborate with others in the community. Here's just a couple of examples of what that might look like, whether it's direct funding, produce donations. We rely heavily on those donations. Logistics, we can't move. Our team is very small in the DC area. We only have 6 staff. 3 of those are part-time. So we're a really very small team. And so moving thousands of pounds, I mean, I can tell you on average in a week, it's around 20,000 pounds of produce that we're moving across our locations. So we definitely rely on our logistics partners and industry experts. I didn't mention it in this presentation, but I know it's on the agenda later on. Food is medicine. It's something that our organization has been piloting in Texas. Again, since we started there, a lot of our new initiatives and ideas start in Texas. But I definitely am interested. I know I've spoken with some of the team from PG Fresh. I don't know if any of you are here today, but just about the opportunity of Brighter Bites being able to join in being able to participate in food as medicine locally within Prince George's County. So I throw that out there as an opportunity. And just any other ways of partnering and volunteering. I'd welcome anybody who wants to experience Brighter Bites. It's one thing to talk about it, but it's another thing to actually experience it. And honestly, the last thing I might say is just the trust we build with the communities. We have really strong partnerships. When we walk into a school, it feels like we're part of the family. And so I offer that as something to others working in the county and locally that, I sort of say use Brighter Bites, but truthfully do use us, in ways that could benefit the work that you're doing. We love bringing more resources to our families and connecting them and seeing them grow and expand and, all good things coming out of this. Thank you so much for helping us building these communities of health through fresh food across the country, and especially here locally for this group. And I hope you will consider joining us. Here's my contact information, and I know I sent the PowerPoint slides to Kim already. So, and I know there's a recording. And hopefully I didn't speak for too long. I'd love to talk to people if they have questions. I have a lot of information to share.
Thank you. That was wonderful. Yeah, please, anyone with questions, please join in.
Hi, this is Aruna again. Rajni, that was amazing what you just shared and what you've done, starting from Texas and elsewhere. And I'm so glad you're in PG County. I would love to connect with you and learn more, because I'm trying to bring food as medicine to a clinic here in PG County, and we are also nationwide, and we are starting with our pilot program here in PG County.
Oh, cool.
And so my question is, since I see mostly adults, will this be something we can work on? So my patients are adults and the clinic sees adults.
Yes, yeah. So, yes, we should definitely talk more. And yes, so our program, while we're in schools, is designed to meet the whole family, the whole spectrum, right? So I would say yes, depending on where you're working and whatever, but I'd love to like brainstorm and hear more about what you have going on. Absolutely.
Thank you.
Yeah. Yeah. I'll figure out how to contact you somehow.
I'll send my information on the chat as well.
Okay, perfect. Thank you.
Anyone else have questions?
I don't have a question. This is Twanisha. Actually, I will be presenting next and to talk about a program that we are implementing here at the health department, which is the family behavior therapy that focus around kids that's obese. So I think that there's definitely some opportunities where we might be able to partner. So looking forward to speaking with you and following up as well.
Wonderful. Thank you.
Welcome. And
And
also we'll be a partner with Dr. Nathan as well. So we have meetings with her. So we are looking forward to growing our partnership.
thank you. I am making a note to be in touch with you as well. And then maybe Michelle. Hi, Michelle. I don't necessarily see everybody on my screen, but I think you had a question. Maybe. Or no, maybe that wasn't for me.
No, it was for you, Raj.
Okay.
I may have missed it in your presentation, so I put it in the chat.
Got it. Okay, so your question is, I was wondering how your program assesses behavior change long-term after the program has ended. Is it with the same families who received the produce? Yes, so good question. So I'll be honest, I don't want to lie to you and give you inaccurate information. My understanding, though, is that yes, we do a 2-year follow-up. So some of the data that I would have shared, or some of the notes that I would have made, would have been based on like 2 years ago, basically, right? So, and if we're following up with families, I can only imagine that it has to be with the same families. I will say from the surveying that we do on an annual basis, we do a pre-assessment baseline, and then we do it at the end of the year. We do a separate demographic survey. But the main one really where we're getting the self-reported and kind of measuring the changes, each year, it is with a select group. This year, we were aiming to get a minimum of 15 of our families from each site. And we work again across a number of cities and a number of schools across the country. So, but yes, so I can double, triple confirm all of our research that's collected is then, analyzed and evaluated and processed with our team in Texas. One of our 2 co-founders is an epidemiologist in nutrition, and she's based at the University of Texas Health Science Center. So all of this works come out of there. So I will confess that in terms of our team, like on the local city levels, when we get, sort of see what the results look like, it's typically on an annual basis when our whole organization kind of convenes for an all-staff meeting. So yeah. I can only imagine that would make the most sense. I don't know how otherwise you would be making those, assessments to see what happens 2 years later. Yep.
Thanks, Rajni.
Yeah, thank you, Michelle. And Michelle, yeah, we'll maybe with Arun and we can all connect on food as medicine. Thank you, everybody.
Thank you so much. And I'll be sure to put your contact information when I send the follow-up notes as well. So if anybody has any additional questions or wants to connect, they'll be able to.
Awesome. Thank you.
Absolutely. Okay, our next presentation is by Tornisha Stokes. She's the program manager of Prevention Link at the Prince George's County Health Department. And Tornisha has recently presented at APHA for the Prevention Link program. She's very dedicated to this work, and I'm excited for her to share the updates. So Tornisha, I will pass the slides to you.
Let's see why I'm having difficulties over here. Just 1 second. Okay. Okay, hi, I'm Tanisha Stokes, the program manager here at the health department. I oversee a project known as Prevention Link. Actually, our new project is Prevention Links 2, and it's focused on fighting chronic disease, basically obesity and diabetes. So I'll start with giving a little statistics because we know how obesity and diabetes affect the whole United States, even starting from the local area, from the state to the entire US. 41.9% of Americans are suffering from obesity, and 38.4 has diabetes. I'm sorry, I said 41.9% are suffering from obesity, and 38.4 has diabetes in the overall United States. And in Prince George's County, 13.8. And Prince George's County population is close to 1 million people. In the United States, we have over 29.7 people who are diagnosed, and also 29.4 that are diagnosed with diabetes. The 88.7 million people, which is amazing, are undiagnosed, and 22.8 of the United States adult population. 97.6 of the adult population ages 18 years or older has prediabetes, and that was information that was calculated in 2020 from the Center for Disease Control and Population. And also in Prince George's County, state in Maryland, 34% of the adult population has diabetes, and 16.8 of the high school students are obese. So we've seen a big impact. And out of that, 19.4% are Hispanic youth. So we decided to actually see how we can help combat some of these numbers to prevent diabetes by offering a national diabetes class. And also we offer the DSMES class as well. And I will get into more information and slides throughout this presentation. So first, I want to just focus on Prevention Link and then provide some outcomes and accomplishments from our grant that just ended in September. It was actually a grant that we received from CDC. It was a corporate agreement for 5 years. We had several partners who helped make this grant successful, which include TLC, the Sigil, University of Maryland School of Pharmacy, HQI, Health Quality Innovators, and iHealth. And so the purpose of this project was to bring together stakeholders with a shared goal of reducing the burden of chronic disease in underserved areas. And we focus within 4 counties. Our focus was in 4 counties: Prince George's County, Charles County, Cabot County, and St. Mary's. And so we wanted to improve the health outcomes for adults at risk are diagnosed with type 2 diabetes, heart disease, and hypertension. We also use the bidirectional electronic referral system to provide patients with access to community support services. And Prevention Link focused on several programs, and these programs was offered to all residents despite of the pair, if they could afford the service or not. Some of them there was co-payments, and some programs was free. So we offered the National Diabetes Prevention Program, which was free, the Medication Therapy Management Program, which was also free, the Cardiac Rehab Program. There was a co-payment for the cardiac rehab and for the diabetes self-management education and support services. And we also offered a remote patient monitoring program where we focus on patients that did not have their blood pressure was not controlled, as well as their cholesterol. So some of the accomplishments with this project, we increased the number of national DPPs from a total of 4 to 16. It was actually a little bit more, but a few dropped out because of, COVID. Again, this was a 5-year project. So due to not meeting the criteria to keep their accreditation, because you have to maintain a certain number of participants in the program, and you have to meet certain reporting requirements. But despite of COVID, we were still able to increase national DPPs from 4 to 16. We had 515 eligible patients that was participating in a national DPP program. 52% of the patients actually completed the program, which there are several challenges with retention. 30% graduated from the program. And out of this, we always focus on sustainability. We love to have grant funds to operate these programs, but grant funds is not always 100% reliable because it can come and go. So we was able to become a CDC recognized umbrella hub, which focused on sustainability. And I'll explain more of that in slides later on. Also, 42 medical practices are part of the Prevention Link network. Regarding the RPM program, we gave out 135 blood pressure devices to participants. We enrolled 77 participants into the RPM program. We actually didn't start the RPM program till late in the 4th year of the project. We had a total of 171 participants who actually utilized the MTM services. We received over 1,300 bi-directional referrals for the various programs that Prevention Link program offered. We also provided the medical practices with clinical decision support and technical assistance to all 42 practices. So that was the accomplishments from Prevention Link, high overview of some of the accomplishments from Prevention Link 1. So we received a new 5-year CDC corporate agreement, which we plan to build upon the lessons learned and outcome from Prevention Link 1. So we're focusing on increasing access to lifestyle behavior change interventions for adults with prediabetes and diabetes, and also adolescents who are obese. We plan to scale up our CHW services countywide to support the assessment and mitigation of the social determinants of health. So in Prevention Link 1, we also had community health workers that we've seen was very instrumental in helping this program become successful, because what we learned, we get the referrals from the providers and the patients say they're interested. And then once we call them later, once they left the hospital or the medical practice, they was not answering the calls. So we implement the CHWs at the point of care, and they're part of that pre-visit planning. So when they're at the practice, they're talking to the CHWs, getting enrolled into the programs, and the CHWs are doing initial assessments for social determinants of health barriers to make sure those patients are connected to resources. If it's for food pantries, if it's for assistance with transportation, daycare, those patients we can identify those social determinants of health barriers right then and there and get them connected to the resources. We also talked about sustainability, making sure that these lifestyle change programs can continue to offer the services to the patients, to the participants who require the service. And we know that the National DPP is a lifestyle change program, and it's proven results that it works. So we wanted to make sure that this service continue throughout the county or the state without having grant funding. So that's why we focus on our sustainability. We also use the latest innovations and technologies in patient care to connect patients and healthcare providers. We use the CRIS system, which is the Public Health Information Exchange for the state of Maryland. We have a local public health information exchange as well. We connect to Workshop Wizard, to RedCap for medication therapy. Our system was also connected to iHealth for the remote patient care monitoring. So we also, again, under Prevention Link 2, We offering programs for residents living with a chronic medical condition who are at risk for diabetes and heart disease. And so under Prevention Link 2, we don't have all of the programs that we offered under Prevention Link 1, but what we are offering is the National Diabetes Prevention Program, the DSMES, which is Diabetes Self-Management, Education and Support Services, and then FBT, which I talked about a little earlier, which I mentioned earlier, but I'll go into more detail. We also will continue to have community health workers as a huge part of this grant, and also the Umbrella Hub arrangement, which is known as Prevention Link Impact. And so just kind of go through the different programs in a high overview.
Twarnisha, you may have frozen.
Can you guys still hear me? Can you still hear me?
We can hear you
Something
now.
happened to my system. Okay. Sorry about that. So the National Diabetes Prevention Program is a year-long program. It's taught by lifestyle coaches, which have to be trained. Eligible participants must be 18 years or older who have pre-diabetes or at risk for type 2 diabetes. And we use their A1C levels, and they can also take the risk assessment. The program is delivered in person, online, or through combination approach. And also because of the public health emergency, so all of the programs that has in-person recognition can continue to offer those classes virtual. The programs is a research-based curriculum. Like I said, is research and evidence proven that it works. And also they focus on exercise, physical activity, healthy eating, weight loss, and also manage stress and stay motivated. And so with the program, it works, but we also see that there are sometimes challenges with retention because it's a year-long program. So we try to come together, the DPPs across the state are in the different counties, come together, talk about lessons learned and best practices, how to improve with retention and enrollment as well. And with some of our partners, including like TLC, we was able to have EHR optimization where we can go in and have the EHR specialist identify patients that was eligible for these programs. And then we will have the CHWs work with the providers to get them enrolled into the program. And then also we had like monthly meetings where the DPP will come and share best practices so they can help keep the patients motivated and motivated and actually participating in the program. And we also seen too, a lot of the self-referrals, they was definitely more motivated and actually completed the programs because they didn't wait for the provider to actually submit a referral. They was already had an interest in the program. And so that seems to work, especially when, this is something that they really want to do and they committed to, taking control of their health. So also with the diabetes self-management education and support services, we didn't have a huge success rate in this program there was this program requires a copay if the patient doesn't have dual insurance. And if you're taking like 10 sessions and there's a copayment every session, that can, add up and become expensive. So as many participants didn't complete this class as we would hopefully they would have. So we did offer other options like the lifestyle change the Living Well program, also the Giant Nutritionist is also available. But we know the benefits of this program include improved A1C levels, manage control blood pressure, cholesterol levels. They had higher rates of medication adherence, healthier lifestyle behaviors. So this is another lifestyle change program that we know that works. And this is a new program that we implemented under Prevention Link 2. This is the first year, which is our planning year. It's an evidence-based treatment for pediatric obesity. The eligibility requirement for this program is children ages 16 to 17 years old. Both the child and caregiver could be English speaking or Spanish speaking. Both child and caregiver must reside in Prince George's County. And again, Prevention Link 2 is only within Prince George's County. It's not like Prevention Link 1 where it's serving all 4 counties. Also, the child must be diagnosed as obese or overweight and receiving pediatric care from a provider practicing in Prince George's County. So we definitely looking to partner with pediatrics as well so we can implement this program. And I think it'll be good to also partner with Brighter Bites. So looking forward to that. It provides a family-centered comprehensive approach to behavior change, including like dietary behaviors, promotion of physical activity, and positive parenting. So this is a new program where, again, we're in a planning stage. So the entire year 1 is to just focus on planning and how we're going to roll out and implement this program. And so the Umbrella Hub arrangement, this is also part of Prevention Link 2 as well. And again, the purpose of the Umbrella Hub arrangement is to utilize multiple stakeholders to connect community-based organizations with healthcare payment systems to pursue the sustainability of the National DPP program. Actually, not just the National DPP program, but the Medicare DPP program as well. And so the health department is the UHO, which is the lead organization that will assist the CBOs with administrative assistance, financial assistance. We will contract with, we actually contract with several managed care organizations so that we can build insurance companies as well. Also, the focus is for the subsidiaries, which is the CBOs, to focus on actually conducting the classes and not really worrying about the building and administrative burden of operating a lifestyle change program. So that's the reason for creating the Umbrella Hub arrangement. And I must note that this was a slide that was shared with us from the National Chronic Disease Directors, because we was part of their Leap Learning Collaborative, which help guide as far as implementing the Umbrella Hub here in the county. And just some general benefits of the of participating in the Umbrella Hub arrangement. The health department was already a full plus recognition DPP supplier. And so now by the organizations, the CBOs joining us as part of the Umbrella Hub arrangement, they had become a full plus recognition. They received full plus recognition as well. Also, the goal is to streamline business and administrative support to the community-based organizations, which is also known as the subsidiaries, so that they can provide the National DPP Lifestyle Change Program. We'll be operating as one Medicare DPP supplier. Also, we're looking for ways to actually scale up by increasing reimbursement opportunities by partnering with various MCOs as well as Medicare, and eventually like the public payers as well, and commercial. So thanks again for listening to hear more about what we're doing in the county. Prevention Link 1, moving from Prevention Link 1 to 2. And we also looking for ways how we can continue the MTM and cardiac rehab program as well, because we are continuing this fight against chronic disease. And I'm just sharing a couple of resources on this tab. And again, that's it. And I just want to give acknowledgement again to all of our partners that help Prevention Link become successful and to get helpful in getting Prevention Link 2. So again, that was TLC, HQI, the Sigil School, University of Maryland School of Pharmacy, and iHealth. And then again, we actually had a network of 42 practices, which include MedStar, private practices within the county, such as Gerald Family Care. It's 42, so I won't list all 42, but we're always looking to grow that network. So thank you.
Thank you, Tarnisha. Does anyone have any questions?
Two.
I do. Tarnisha, how many families that the one the last initiative family already
Behavior
blanking out.
therapy.
Yes. How many families do you think would be enrolled in that program?
The goal is to get 300 per year for 5
Okay.
years. Well, for 4
Okay.
years. Yeah.
Okay.
I just wanted to say thank you. I'm really looking forward to working with you.
Likewise. Yes, we will definitely be in contact. Let's see. I was wondering. I'm sorry, just saw a message. I'm trying to see. Sorry. I was wondering how Credit uses Z codes as a way to bill e-referrals. So we don't use Z codes to bill. Is it G codes? Is G codes, I think, to bill. I have to go back and see what are the billing codes, but we are billing the managed care organizations, and we're in the process of becoming a Medicare supplier. In each I'm trying to I can tell you the codes. Just 1 second. Just let me pull it up, and I can tell you, Michelle.
Oh, that's okay. I don't need the code. It's more like I'm just curious about ways that we can sustain funding for these types of programs. So it's more of just, I'm always just experimenting and just trying to understand more about how we can make these things sustainable. And so I know that CMS has changed the ruling that allows for people, clinics, to bill for referrals for SDOH. So of course, that's what your staff are doing. So I was wondering if that was built into the program to allow for this program to continue, or like if that's working or not. I was just curious about that. So I don't need to know the specifics, but just your
So
feedback on what that's like.
Yeah. So we billing based on the performance measures met. So there are certain performance measures that must be met if they attend 1 class, if they attend 4 class, 5% weight loss. So it's different measures, and we can bill based on those measures. For the CHW services, we're not billing, and Caitlin probably can add more. I don't think we're allowed to bill yet in the state of Maryland for CHW services, but I think there's some talk around it, and I think Medicare, I believe you can start billing for certain CHW services starting in January. But Caitlin is the expert, so she can provide more around CHW services.
Yeah, so they did. I'm sure folks probably know that they did add that, add some codes for CHW services to Medicaid federally. But in Maryland, there's no specific, on Maryland Medicaid, no specific CHW service reimbursement. As of right now, I think people are still trying to figure out a bit what this this new billing code means for CHWs and how it's going to be handled. So more to come on that. There's also energy in the state, I think, around adding that to Maryland Medicaid. But as of right now, I don't think anyone's billing.
And I think there's another, maybe I'm getting this confused because I'm not an expert. So that's why I'm asking the questions. But I think there's something else coming out with CMS of putting more accountability for healthcare providers, including those hospital systems, for when we refer folks for, when they're referred for social determinants of health needs, there's some sort of accountability mechanism that will also change. And so, Caitlin, if anything changes around that, I'd love to learn more to better understand the ecosystem we're working in, so that we can keep these things going and so we can connect everything together.
Yes, sounds good.
I think I just would want to add to that. I know in January there is a requirement for hospitals to do the SDOH screening, and I know we've been talking about collectively how do we streamline that process. So if within the hospital systems and also working with physicians, or even looking, we talked about this at the community coordination care team, like how do we share these SDOH screenings that are done on participants, so they're not doing 3, 4, 5 every time they engage with another program. So I know that that's being worked on as well. And I know when we're working with the practices, we're trying to figure out how do some of the SDOH screenings that are happening at the hospitals be shared with the primary care providers. So hopefully we'll get this whole community coordination care team worked out in a centralized way. But that is happening in January. So. And I just wanted to say thank you, Tornisha. We really enjoyed working with Prevention Link 1.0 and look forward to 2.0 as well. So,
yes, likewise. Thank you.
Excellent. Well, yes, thank you again, Tornisha, for the presentation. We will be sure to share the slides and her contact information so that everyone can get in touch. Looking at the clock, we have 5 minutes left. So I just wanted to take an opportunity to share that the Prince George's Fresh Food as Medicine Pilot Evaluation Report is now available. I will put a link in the chat for everyone to review. And Michelle, would you like to take a minute to give a quick summary?
Oh yeah, just check it out, share it. We want to be able to benefit the community. And if you have any questions or want to talk about it, feel free to reach out to me. I'd be happy to chat further.
Excellent, thank you. Any other community announcements or any updates from Jessica or Anthony, our co-chairs? Internally, we do have a community announcement. The Prince George's Healthcare Action Coalition quarterly meeting is next Tuesday at 6 p.m. at the Kentland Community Center. So we'll be in person, we'll have warm food catered by Sardi's, and then we'll have presentations by presenters representing 211 Maryland, 311 Prince George's County, and Fund 988. So we look forward to anyone that can come and take advantage of the opportunity to ask questions of those presenters and how we can further get information about all of our health engagement programs in the community. Our next HEAL Workgroup meeting is February 7th, 2024. But please keep in touch if you have any updates until then, or if you're interested in getting more involved in the Food as Medicine or Healthy Food Priority Areas work group. We'll be continuing those before the next meeting as well. And last chance, any updates from Anthony or Jessica, or just want to say hi?
I'm sorry, I had myself on mute. In listening to both of the presentations, Department of Parks and Recreation definitely can play a role if the hub is developed, because obviously we have dozens of facilities spread out throughout Prince George's County to assist with physical education, physical fitness. Plus we have hundreds of neighborhood parks and community parks that are accessible. But if there's a way to support those initiatives, we would definitely want to be a part of that conversation.
Absolutely, we can connect. So if you don't mind putting your contact information in the chat, I might already have it, but if you don't mind, yeah.
Not a problem.
Thank you.
Great. Well, thank you all so much for a wonderful and engaging meeting. And I hope you all have a great holiday, and we look forward to seeing you in the new year.
Thanks, everyone. Have a great day.
Thanks, everyone.
Thank you. Bye.
take care.